Thank you for joining us for our WTVA 9 News Coronavirus Town Hall. I'm Craig Ford, joined by Dr. Mason with Baptist Memorial Hospital, Union County, here to answer questions that we have, you may have, concerning the coronavirus. How is this virus transmitted? I've heard a lot of different things about that.
Primarily, it's transmitted by respiratory droplets. When you cough or sneeze, the virus gets in the water particles that you cough out. It's aerosolized, and you breathe it, or it gets in contact with your mucous membranes.
What about surfaces? Could
Yes.
they be on surfaces?
Yes, that's a good point as well. When you cough or sneeze, some of those droplets can get on surfaces, and if you touch those surfaces, you touch your mouth or your eyes or your nose, you can get the virus that way. That's why hand hygiene is so important. Washing your hands properly, using a hand sanitizer with at least 60% alcohol. Don't rub your eyes, nose, or mouth. Just things that our mothers taught us when we were little.
So really basic common sense hygiene that we've been taught. Exactly.
Don't be around people who have flu-like symptoms. If you yourself have flu-like symptoms, don't be around people.
Okay. Any idea why the virus is so contagious?
You know, that's a good question. Now, I will admit that I'm not a virologist, so I don't know all the behavior of viruses, but each virus has what we call an R factor, and that tells how contagious it is. For instance, if a virus has an R factor of 1, that means for the most part somebody who has that virus will infect one other person. I think I've seen different numbers, but maybe for the novel coronavirus, it may be around between 2 and 3. I think flu may be between 1 and 2. I don't know those figures exactly. It's a little bit more than the flu, but to give you a little perspective, the measles has an R factor of 15. So the measles is much more highly contagious than coronavirus.
I know we've heard a lot in recent days about how older folks are more susceptible to being harmed by this virus. It may seem like a no-brainer to you or to a lot of other folks, but why them instead of somebody who's younger or even children?
Why them?
Well, why they would be more likely to suffer, to either die or to
well, that, you know, it's just like with any other viruses like the flu. People who have comorbidities, heart disease, lung disease, they are more likely to have serious complications. When it comes to chronic medical conditions, most of those occur in our older populations. So I think that's really the correlation, is that most of the older population are the ones that have these chronic conditions. We have seen across the country, we have seen some younger people with chronic medical conditions who've gotten seriously ill.
And by the way, what exactly are people dying from? I think I had heard somebody say that virus really gets deep into your lungs,
yes.
Right?
It can attack your lungs, and if you look at the chest X-ray, it causes something that we call interstitial pneumonia. And if people have chest X-rays or CT scans, it can show that. But a lot of times, is what happens is it's the super infection, the super pneumonia that you get. People can get influenza or coronavirus, they get the lung issues, but they get a superimposed bacterial pneumonia on top of it, and that can lead to respiratory failure. It can lead to end-stage or end-stage organ disease, and it can lead to sepsis and death at times.
I do want to share another viewer question, and
sure.
I would be shocked if you have not been asked this question. One of our viewers wants to know, are others overreacting, or are we not reacting enough?
I think that's a great question, and it's a question that we don't exactly know the answer to. But Dr. Anthony Fauci from the National Institutes of Health, we've seen him on the TV, and I've grown to really enjoy watching him, because he's what I call a straight shooter. I heard him say that if you think that you're overreacting, you're probably doing the right thing. At the end of the day, we would much rather say that we overreacted rather than saying we didn't react enough. And I know we don't have a lot of, there's not a lot of hockey around here, but he also said that when we're looking at this, you always want to skate to where the puck is going, not to where the puck has been. So it's what we're trying to do. We're trying to get ahead of the curve on this disease. So, you know, if we're overreacting, so be it, as long as we beat this.
More of our WTVA 9 News Coronavirus Town Hall right after this.